It's just the nature of the beast. And the invisible hand, the virus ignores it. I mean, the thing is, let's face it, virus doesn't care whether or not, well, one state's going to do better, one. They don't. They're going to come and infect anybody, no matter what the economists say. And if you want to look at the economies, look at the economies around the world. Ankit puts it on every day. Who's doing the best per death? It's actually Germany because they're testing people, and New Zealand because they did sequester people. In other words, there was actually some leadership, a hard word to describe. I mean, it is dangerous, I agree, to give politicians that ability to make decisions.
Let's take another look at an impact that has just really mind-boggled me, because I think it's going to impact our economy greatly. Crime rate has dropped considerably, and Miami, of all places, reported 0 murders in 7 weeks. They have never done this before since 1957. 0 murders in a span of 7 weeks.
Can you believe that? The coronavirus shut down murders.
You know, where you look at some things have adjusted us bad and poorly in the economics, maybe we can balance it out based on how we're going to have to spend our money. We've cleaned the ozone area, so maybe we don't have to spend as much money on doing the cleaning of the ozone and research of that. Maybe we need to pull back on some of our space research. I mean, this is not my agenda. I'm just saying maybe we can take a look at some of the things that we're spending our money on, like you do at home, right? And say, hey, you know what? But I don't want to say let's reduce our police force. I still think we need the same amount of police, and they need the same amount of resources and funding. But we've reduced crime considerably. India has reduced crime.
There has some benefits. Crime has been reduced, and over in India, Ankit knows this, Mohammed knows this, they can actually see the Himalayas now. Do you know? Believe so what's that?
We are still happy. We didn't get a stimulus. We are still happy, and we are just trying to understand what Americans are doing with the stimulus.
What we're doing with the stimulus.
I get this all the time. What are you guys? And why are you worried? So,
and the most important thing, rather than getting a stimulus by the government, the people have donated back to the government.
Yeah,
in millions of dollars.
In India, yeah.
Is that
in India?
Is that in India?
Okay, and the government took from their own paychecks. The government took from their own paychecks and put back into the economy. So
I would like to ask Professor Edward that when you talk about stimulus, government is giving away a lot of money to the people. Why can't we cut taxes for a year and then manage the economy like that?
That's my idea. Yeah, that's what I want. Nick knows I love to do that. Cut the taxes.
Okay, so I think I'm here in part to stir things up a little bit. Right?
Yeah, that'd be great.
Yes. Well, yeah, let's stir it up. I love to stir it up.
Listen. I understand, Kimberly. You're finding some silver linings here.
Yes.
Good. All right. 20.
Yes, it is good.
20-some%, according to my colleague at Yale. 21% of us, or maybe 29%, somewhere in there, can work at home. Well, that's great. Mm-hmm. I mean, I get to clean out my stuff and sell on eBay and reflect and so on and so forth. But 79% of people are really in big trouble. They can't work at home. Our unemployment rate is skyrocketing, 15%. Small businesses are getting hammered. So I do appreciate the silver linings, but it's a tale of two cities for people like us, probably, and people who are trying to actually go to work and run small businesses. So I think we have to get the small and medium-sized businesses going. And then I'll stir up one more thing with Nick. And I think this is always a tough problem. How much direction do you give to people, and how much do you encourage them to make decisions on their own? But you just said exactly, 5 minutes ago, exactly what people should be doing. And don't we, at some point, especially given the potential duration of this crisis, need to trust people and really tell people this is on you? And the other reason why I would say, I'm a little bit concerned about putting too much guidance out there and having the government do everything in terms of deciding is it flashing green or flashing yellow, is that I don't think governments can figure out all the myriad of situations in which we're going to have to exercise judgment and reach decisions and enter into contracts and transactions. It's just too complicated. So I think we're stuck with individual judgment, aren't we?
Well, it would be nice.
Wow.
I mean, the thing is to have self-responsibility
Wow.
is something that you have to preach people to do. But to think that the humans are going to operate like computers, if you tell them to do A, they're going to do A, that's not true, because we're always going to gravitate toward the mean. And so the thing is, I have to be beat up all the time, because the thing is, I love this thing called junk food. See, there's Pringles right there. Okay. And if somebody like my wife doesn't come in here and rip my Pringles away from me, this thing will all be digested by today. And see, that's the reason why you need to have some leadership. And I'm very fortunate. My wife and my dog tell me what to do. But a lot of people don't have that ability. And so what they'll do is they'll stay home, watch IBM TV, and eat Pringles all day. And then they gain weight, and then they won't do anything healthy, because somebody has to, unfortunately, give them what they call guidance. I totally agree with the macro management, because as a tax attorney for 37 years and a professor at Northeastern University's graduate tax program, the Internal Revenue Code is bloated with micromanagement. It's insane. No one even knows what the rules are, because there's way too many of them to know. And why do they have them? Sometimes they're put in like 1974 and they just stay there because no one reviews them. So the government does have that tendency to what I call micromanage a situation that doesn't need to be micromanaged. What we need is good management, also individual responsibility. No one ever, doctors don't even want to tell it. I know Dr. Rackner, do you ever tell a patient who comes in saying, wait a minute, you're way too overweight, you need to lose weight? Now, some of them do. They say, look, this isn't good. Your BMI is out of proportion. Because it's really hard to tell people that they've got to change to better their own particular situation. One of the doctors we had on here was saying that recommended that the client be intubated and put on a vent immediately. They were in deep trouble. The client goes, no, I don't want to do it unless I'm under cardiac arrest. And he goes, you know what the odds are when you go to cardiac arrest, I put you on a vent? It's like 0. And you know what happened to that client? He died. I mean, and so the thing is, you do have this Darwin, if you believe in Darwin awards that are being handed out right, left, and center. But I believe part of the reason that Darwin awards are being awarded to these people is they're not getting the proper education in this area that they could be given. And then, of course, it could be the human choice. Do not resuscitate, do not intubate, and then go ahead and die. That's what I call an acceptable mortality statistic, which we do have in this country. At least life insurance companies use them all the time. They go, we know that these amount of people are going to pass away every year, and we expect it. This, unfortunately, for the life insurance industry is not good, because you have now unacceptable mortality statistics that aren't built into the model. So some insurance companies, even today, because I got a report from my company in Salt Lake, they go, if you're over age 70, a lot of companies are not going to underwrite you. You don't get insurance.
All right. So I just wanted to offer the contrarian view that I have a lot of faith in the American people, in the resourcefulness and heroism of just normal, everyday people. And I already
that word.
Good to have some positive thinking out there.
Well, as a surgeon, I've seen people do pretty extraordinary things. And I think that we are witnessing today people doing extraordinary things, like expecting people to shelter in place. Yet here we are all together doing this together. Right. And I have had multiple conversations of people who just wanted a different idea about how to pivot. So for example, I was talking with somebody who works at Indian casinos, helping create intimate environments. Mm-hmm. And he was just bemoaning the fact that what's going to happen to his business? It's dead. And I said, no. I mean, how is it that you can create an intimate kind of experience in a time of social distancing? Mm-hmm. So I think if we just put the seed out there, that go ahead, let your imagination run wild. Let's see what we can come up with. I see that as our future.
Mm-hmm. Yeah, and there's a lot of there's a lot of different ways to do that because the casinos certainly can have social distancing. If you go to Las Vegas, you're going to see there's a lot of these slot machines, and certainly you can space them where people aren't getting close to each other. You can disinfect them, but also you can do like Germany. They test people. If you had all the people that come in the casino and they're all clean of COVID-19, then you just actually did is you increased your odds that you won't get that. It's all about the numbers. Can you increase your odds so that the odds of you getting it are minuscule, and the odds of you, if you had to go into a hospital, becomes minuscule, and then it becomes basically acceptable mortality because very few people die.
But we're talking about re-entry policies, but sure. I think right now the concern is and I have to agree with Edward in many ways that that we have to get the small businesses back up and running again because they are what feed our community.
Of course,
small businesses are the lifeline and always have been. And if we let the small businesses go, and what we notice again, Nick, we said the stimulus package was truly a bottom up. It wasn't. Right. There were companies that got $20 million that could have gone back to the small companies just as easy. And my thing is why are we giving Ruth Chris $20 million when that $20 million could have gone to my small medical practitioner that is out of PPE equipment?
I can answer that question real easy. They have better lawyers. Okay, so anyway.
No, they have better CPAs, and they filed. Here's where it was unfair. They had CPAs and lawyers who read the bill the day it came out, rather than waiting for next class, and they filed the paperwork a week before you had to file. They
what do you mean read it before it came out? We read these things while they go through committees in Congress.
I know, that's what I was doing.
So the thing is, it's not like, we're going to read the bill as it come out. No, the thing is, we got people tracking these
that's what I'm saying.
As they're going through the House Ways and Means Committee way prior to that getting passed. So when it comes out, we can isolate and make our move for our client. Come on.
Right. But every Joe and Jane out there that is a small business didn't do that.
Well,
they were waiting for the red flag. They were waiting for the checkered flag to drop and go race cars ready. They were waiting for that. They did not have the education.
How much a legal attorney charges for filing a stimulus in the US?
In the US, well, see, the thing is, they actually have a scale of what you can charge if you're applying for the loan. Then you have your independent hourly rate, which ranges around $450 to $750 per hour. So the thing is, you got two ways to bill.
They ran out of money.
As an attorney,
it doesn't matter. They ran out.
No, we got refunded again. But remember, as an attorney, you have your two best friends, Bill and Sue.
Bill and Sue.
Okay, you always got to remember that, because as long as you have Bill and Sue with you, you're going to do well as a lawyer in this country. So
no, the mortician's doing better than both of them right now.
Better than both of them. But the thing is, right now, you could actually reopen a lot of places, including the casinos, as long as you do it smart. Because there's a lot of space. And also small businesses, they allow Walmart to be open, but my vacuum cleaner, I need my vacuum cleaner fixed, okay? There's not that many people that are in that shop at any given day during the good economy. You're easily socially distanced. Why did they close my vacuum cleaner shop? They don't need to do that.
Okay.
Yes, Professor.
This is the example I've been waiting for. You've got Pringle crumbs on the floor.
Yeah,
you need your vacuum cleaner.
Yes,
and we don't need the government to tell us that the vacuum cleaner store should be closed. I
don't.
I mean, we have.
So I think it just needs to be knowledge, though. They never gave us. They were never transparent with us. Okay, CDC had high classified meetings and reports that they were generating back in January. I even saw a press conference where a couple of them got reamed by a couple of senators. Why didn't you just tell me? Well, that was classified. But they weren't transparent. And if you don't have the knowledge, you don't have the right stuff to fight this off. If I had the knowledge of, Kim, you could keep your store open, but if you have a lot of people in there at one time and you're not keeping things disinfected, somebody might get sick or you might get sick, then I'm going to say, okay, here's my policy. You come into the store, you wear a mask. Yeah. You come into my store, you wear gloves. Then I wipe everything down, one person at a time. But I didn't have that knowledge. They didn't share that with me. They were not transparent. They lied to us.
And the other problem with the government is, Professor Schneider, they have one
But
rule
they were
that applies
honest.
to everybody. They do one rule, it applies to everybody. So everybody has a small business shuts down. That is not smart government, as you know. That's dumb government. I mean, and so the vacuum cleaner guy got shut down, and I'm going like, why? There's nobody in his store. In the meantime, you can walk in and out of Target, walk in and out of Walmart, where lots of people are there, and they guide you through little things. But I could go to my vacuum cleaner store. There's only me, the vacuum cleaner person, and when I'm in there at any point in time, there's only one other person there. But they take one rule, it's applied uniformly through everybody. It's just not smart.
But transparency makes you smarter. Knowledge makes you smarter on how to deal with the situation. And if they had been transparent and honest to us up front, we would be like Hong Kong right now. If you look at the data tells the story. Hong Kong never shut down. They closed off international flights. They closed off China, but they never physically shut down. All their businesses operated. Why? All of their businesses did this.
Yeah.
All right. Restaurants were only allowed 2 people. Why? Because they told their people the truth. Yeah. So I agree with you, Edward. If we were given the right information, we can. But if you're not given the right information, you're a complete idiot.
And we already have the information.
You're flying an airplane when you should be flying a car.
Ankit, put up the world information. Ankit, you have the world information. We already have the information out there.
I agree with you.
Statistics. Because if you look at the data from the rest of the world, you can then figure out what this world should do. We don't need the states competing for good and good ideas and bad ideas when the world has already done that for us, and we can see what the bad ideas and the good ideas are out there. At least there's data indication. It's not going to be 100%, but it can give us data indication. And Germany, of course, I guess we'll eventually go. There we go. Let's take a look.
I have faith in people if you give them the right information. Just like Dr. Vicki said,
the United States is the world leader. Look at this, Dr. Vicki. We're leading the world in coronavirus. We predicted over a month ago that we are going to have 1 million. We did at IBM TV, 1 million people infected by the end of the month. We're getting really close to our number.
We're almost there. Well, this is 3 million for the world.
That's for the world, and that's the deaths. But let's scroll down where you can see the data from the rest of the countries. This is real.
U.S. We're right where we predicted. We're right where we predicted, Nick.
Now,
that's the difference between you and I and them is we know how to do data.
Representative, sir? Is this representative of the best healthcare system in the world? Is this representative of the world leaders and the group that spends the most on the healthcare system? Is this the result you would expect from the world leader? I say no, this should not be the result. So somewhere along the line, there has been a failure in our system where we wouldn't be the world leader in a place we really don't want to be the world leader. However, when you look at this, the most important data actually appears third from the left. Deaths per million population, 169. Remember, deaths are just raw data, but if you look per 1 million population, that becomes more important. We have 169, and we see Germany at 71. Germany beat our tails. We have more per 1 million. And then you got to figure out, well, why did they beat our tails? You go further down, you see Russia and China, and you discard the data because the data may be better.
Let's go even better. Let's go down to Hong Kong because we have them on the show with us a lot. So we get to hear. They never stopped working. They never stopped.
Yeah, but they assuming again, you've got to assume the data is good. Is that it? 4 deaths? They have, but the population's only 7 million, so it's really death per million.
But it's 0.5 per 1 million. Let's see if I can get it.
No,
every time I read.
How far down is Hong Kong?
No. You went further down. You need to come a little up.
You found Hong Kong?
Ankit's got a better memory for these than I do. And I don't know if they move around based on their.
The data's updated.
As you're looking for this,
there it is, right there. There it is.
Total cases 1,038. Deaths per million. Whoa, that's good for them. 0.05. And that's the important thing. That's not very many. So the thing is,
that's somebody we need to pattern ourselves after for a pandemic situation.
Check Hong Kong versus New York City. Who wins? It's not even close. So who would you want to follow? What the people did in New York City or the people in Hong Kong? And you can argue, well, the people in New York, they live on top of each other. What about Hong Kong? I mean, it's not like they're spread out in Nebraska. Come on, they're living on top of each other, but they were managed properly. So the thing is, managed properly made a big difference. They did close down. They do wear masks. They do self-protect. And the thing is, what is the total result? Well, they have 4 deaths and 1,000 cases out of a population of 7 million, where we're off the charts in New York City. So somewhere along the line, there's been a big failure, and they're right next to the epicenter. Now, the only other argument I can see is the Hong Kong data is incorrect. In other words, we're being lied to. But if the data here is correct, then we have some really serious things we have to look at. I believe the German data is correct, but we do have a lot of data that's already in, and we can hypothesize from the data what our moves should be next in terms of the virus. And some of the data is good. Some of it's what we call corrupted bad data, but there's not much you can do about it. You can only hypothesize which ones.
So Nick, I'm gonna before I get more depressed.
Why are you Professor, you just go play golf.
It's been great interacting with you, and I look forward to the next opportunity.
Okay, great. Well, good to have you on, and thanks for coming. And this is another good thing we learned from Natase, or whatever it is. Okay.
Namaste.
Yeah, that stops the spread of coronavirus. Just a good thing.
And happy economics.
Yes.
I know that you've got answers for us. I know you do. Thank you.
Thanks, Professor.
Be well.
See you back.
Bye.
I agree with you. I think there's a way.
Yeah.
I think there's a way. I agree with him. Vicki, welcome, Doctor.
Yeah, welcome. Yeah, I missed your show the other day, but let me tell you something. I told a lot of people about that, and they really want to do a special on that. Especially, I hate to say, the financial advisors who want to learn how to work with physicians, and a lot of the financial advisors are clueless. They need some education there. Did you write a book on that also?
Yeah, I've written a couple of books. The Myth of the Rich Doctor and the 9 Money Mistakes that doctors make.
Wow. Okay.
And so I'm kind of a cultural anthropologist looking at doctors and their relationship with money. It's kind of interesting. In the United States government, we have this separation between church and state.
Right.
And in the field of medicine, we have this ethic that the care that a patient gets should be independent of a patient's ability to pay. So boomer physicians like myself, we're just trained not to talk about money.
Sure.
And many, many doctors have lost lots of money in what I call dumb doctor deals. But listen, we can go there. But there's something important that I wanted to say. You were talking about the disparity in COVID, and you were mentioning that we in the United States, spend the most on healthcare. But I want to point out that there is good data that suggests that we are not getting the bang for our buck that other people do. Mm-hmm. So I've pulled out a report here. The headline is, among 11 countries, U.S. ranks last for healthcare outcomes, equity, and quality. So there's this myth out there that we have like the best healthcare system in the world. I wish that were true. We spend the money, but we're not seeing the outcomes.
Oh, I think the coronavirus just proved you right. Okay, because the thing is, like I said,
the data shows everything.
That's what we should have, given the amount of money that we spend on our healthcare system, we should have had a better outcome than Hong Kong or Germany or a lot of these other countries that are just, frankly, they're beating our pants in this particular area. So, yeah, it is.
Well, first off, we fired our pandemic team. We were ranked the world's best for pandemic teams, and we fired them. And then, 2 years later, we're dealing with a pandemic without the team. And a lot of these other countries, they listen to their doctors, their top leaders in infectious disease, as opposed to just the leader himself, who was smart enough to say, I surround myself with smart people. I am going to listen to them. But we didn't do that in this country. And instead it became a political game, not a medical game. This whole thing became politics. I don't know if you agree with me, Dr. Rackner, but I think that we lost our humbleness. We lost our respect for humanity. because everyone made this an economic situation. And you know, like Ankit says, we're all happy here in India. We're flat broke. We don't have any money. But it was about the people. And
Yeah.
I think that's one of the things that I enjoy being on the show with Ankit is that there is no stress in their country. As soon as I hang up with him, do you know what the first thing I have to deal with?
Tell us.
Finances.
That's
And
American.
woo, what am I going to do? I got to pay the bills. I mean, but for 4 hours, I'm on a show. We're talking about some progress that doctors are making, how wonderful things are in other countries. Hong Kong gets to go out to eat every day. Their businesses didn't suffer, you know. So we got these solutions. We know these things work. Why are we not implementing them? Maybe Vicki can help us, Dr. Vicki. Maybe you can help us realize psychically. Go ahead, Ankit.
A lot of viewers are asking us that they are stuck in some part of the world, maybe some other city, and they're not at home during lockdown, and they are mentally disturbed because of that, because they are staying at some other place, maybe a friend's place, maybe a cousin's place, and they are not able to come back to their home.
Mhm.
How they manage the
How do
mental?
you do that? Hey, you're stuck in cyberspace in another world. How do you deal with that, Dr. Rackner?
I'm sorry, could you repose the question?
Solitary in another country because you're stuck in another location and not your home, that you've had to become sheltered down in another world that
Right.
isn't your home. How do you deal with that mentally? That's what he's saying. There are people reaching out right now asking, how do I, because mentally that's disturbing. It's
Okay,
disturbing
so-
enough when you're alone. But
So, I mean, I'm not even out seeing people in my community. I'm not engaging in religious practices that I normally do. So it doesn't matter if you're separated by a country or separated by just a couple of miles. I think the best thing to do is just recognize this is hard. This is a big price that we're paying, and then use technology like this to get in touch with people. You know, we're not alone. We're all in this together. And when you think you are alone, I think a great thing to do is just think about, okay, what is it that I want in any moment? And figure out how you can get it. Do you want to just share a joke? Do you want to touch something? You know, I talked about my neighbor coming over and petting the dog. She was just here last night again. So you can get what it is that you want once you just recognize what that is.
Mm-hmm. Yeah, but the thing is, what city are you
I agree with you.
Dr. Ratner?
I'm in Minneapolis.
Minneapolis, okay. Where in
Twin
Minneapolis?
Cities.
Right,
The
well,
Twin
there's
Cities.
Minneapolis, there's St. Paul, there's Edina, there's Bloomington, there's Coon Rapids, there's Minnetonka. What city in Minneapolis?
Little Canada.
Oh, Little Canada.
Little Canada. Where's that?
It's in St. Paul. We've got these little maple leaves on all of the street signs.
Right.
It's very funny.
Yes, right. It's a beautiful place to be during the summertime, by the way. You know, I used to fly up there during the wintertime, and I spent one day when there was these mounds of snow all over the place. I'm going, what's this? Oh, that don't melt till May. I'm going like, no, you don't understand. This is my last flight during the wintertime in Minneapolis. But they love that stuff. I mean, they're, you know, you're from Minneapolis. They kind of like that stuff. They're into that.
They have a Calhoun Square there too. And so
Really?
I've been the Vikings are my I'm one of their biggest fans.
Oh, really?
No kidding.
Yeah.
That's
Yeah, you
great.
should watch our football show. We have a football show. I'm on it occasionally, and they love it because I'll wear my jersey. And
All right, well, tell me about targeting doctors. I told my business partner about this. He fell over his chair. He goes,
Okay.
this is something that financial advisors struggle with. Well, what's targeting doctors? How does this
Okay, so I started, well, it's a long story, but I started helping doctors achieve the personal, professional, and financial rewards that attracted them to a career in medicine.
Mhm.
And what I found is that unless and until doctors had the financial foundations, they were limited in choices. Like I spoke with a physician who had this vision for a multidisciplinary weight loss retreat. And I said, this sounds awesome, but you know, it might be a while before you monetize this. How much in savings do you have? She said, savings? I don't know how I'm going to meet next month's mortgage. And I said, well, I really can't advise you to take any sort of financial risk. So I've talked with hundreds and hundreds of doctors about their money stories. And I think that we are very fortunate. We get paid very, very well for what we do. But most doctors, believe it or not, have a really hard time translating their high incomes into true wealth, the freedom to do what they want to do when they want to do it. And there are a number of good reasons why this is the case. But I think that since half of doctors are behind in retirement planning, this is pre-COVID, and only half are working with professional financial advisors, we know that the ones who are working with the advisors are more likely to be in a position of having the freedom to do what they want to do when they want to do it. And I thought, how do I leverage my efforts? And I thought, well, if I could help financial advisors understand doctors and their relationship with money, understand how to engage them, that's the biggest impact that I have. But the problem is that there is this culture of medicine that makes it really difficult to happen. And this is illustrated on my favorite show, my favorite episode of Shark Tank. So this doctor went into the Shark Tank to get funding for his company, Syndaver. They sold synthetic cadavers. This is $1 billion market. There were already millions of dollars in sales. The sharks were all engaged. And I thought, man, this guy's going to get a 5-shark deal. But then the questions started like, tell us about your revenue. Tell us about your profitability. And they're on national TV. This doctor said, well, I suppose I could be making lots of money if I wanted to, but money's not that important to me. Service, making a difference is what's important. And with that answer, 4 sharks were out. He got a deal with Robert Herjavec that fell apart within a couple of weeks. And the problem was not the value of the company, the value that this guy brought. It was a question of not having cultural competency, right? Not understanding the world from the buyer's perspective. And so I think that financial advisors have the same challenge as they go in and they try to engage doctors. They're not saying the right things. They're not understanding that doctors are driven by service, not by a bottom line. And if more financial advisors could really understand what it's like to be a doctor, what's important to us, what's the best way to engage us, they're going to be more successful. Now, listen, I get that there's a whole bunch of people struggling, and physicians are a very fortunate group. That said, I will also tell you that there are specialists, many specialists out there whose elective cases have been canceled to flatten the curve. We don't want the demand for healthcare resources to exceed the supply. So elective cases are off. Even patients who have cancer are not getting their chemotherapy right now. So we've got a huge number of physicians whose incomes overnight dropped from 10 to 90%. And the American College of Surgeons projects that they're not going to get back to operating until at least the 3rd quarter. So what are these doctors doing? And I spend most of my days figuring out what these doctors can do, how their value can transcend their ability to treat any given individual patient in a certain way. But doctors need help right now. I know that this is not a popular thing. I generally don't have these conversations outside of the medical community or outside the financial services community. But this is another impact of COVID-19.
Well, I have a whole stack of financial advisors that I float with because I've been in the industry for 37 years who would love to hear your story. So what I'd like to do, when you have time in May, just give me a date that you can share your story with them, and I will flood you with these financial advisors that would love to read your book, by the way. I didn't know there was a book out there.
I'm going to get her book. She's got 3 or 4.
Just email me the date and the time, and you'll be stacked with financial advisors.
Let's do it now because doctors need help now.
Look, whatever is good for you. Okay, so the thing is, just email me.
Well, we can do, and the thing is that there have been a lot of requests for the kind of advice that Vicki's giving, because it's not just about surviving one virus or surviving another future virus. It's about just surviving life impacts as it is, period. And that any of us get hit with an impact. The problem is that a lot of times we make choices that we have regrets with, which is one of the books that she has is about making these choices without regrets.
Right.
So, and I have a feeling that book is more about caregiving without regrets. It's more about making choices. But I know we need to wrap up. And I asked Ann Kid if I could share a special interview before you leave, Nick. I want you to see this. Because this goes along with what we're talking about, the economics, the soundness of health and wealth and health. And so I want to share this with you. So bear with me, because I have never shared from here yet. So just give me a second.
You got to press the button. Ann Kit knows how to press all the buttons from New Delhi.
No, I'm doing it. Hold on. Hold on just a second.
Oh, yeah. Like, that guy looks familiar. Okay. That looks like Doug Tillett from the Federal Reserve. That looks like you. You got to turn the voice on.
Volume. Kim, we can't hear.
We can't hear. No can hear.
Okay, hold on. I'll stop. Hold on. Okay, because this is really good advice.
Yeah.
Hold on.
You got to have the voice on.
Unmute.
Hold on. So, yeah, hold on. Let me. Where do you think the mute is? Hold on. Because you got to hear what she has to say. Hold on, because this is beautiful.
You need to unmute.
All right, let me try it again. Okay, got it. You know what? Technically, we're learning a lot. If you hang out with us, you'll learn how to do all of this. And and here we go. Let's see. I'm actually usually pretty good about this, but let's get this
program. And so I put in my essay that the connection between them is that, like, the similarity between them is that when you're being financially healthy, you're putting money into your bank to be financially healthy, and you're investing and you're doing everything to make your financial self healthy. And then for your physical health, you're exercising, you're putting good food into your body to make your physical self healthy.
So feeding your body, feeding the bank,
yes,
greens, right? Pretty much makes you healthy, right?
Yes.
Green in the bank and green in the body. Very good.
Really learned a lot. Like, I never knew what stocks were, what investing was. I learned methods to save my money properly, and I learned a lot.
And can you tell me what the Money Savvy Pig says for us?
Save, spend, donate, and invest.
Well, my teacher.
All right, there you go, guys. Yeah. That's our future, right?
Yeah, that's actually a program the Federal Reserve puts on. We were very fortunate to do a 5-part series in Chicago with the Federal Reserve of Chicago, which I think covers Minnesota. So the vice president let us in and do a whole series with them. But they actually put together money literacy programs because, as you know, one problem that we have in this country is that you don't take Finance 101 or Mortgages 101 when you're in high school or college, or frankly, even Retirement Planning 101 is not taught in any major university, which has been a big beef of mine because I've been a professor at Northeastern University for 10 years now, the lead faculty for retirement plans. And I went around the country to look at all the universities, the major universities, and see where you can take a retirement planning class. The University of Chicago doesn't offer one. Yale doesn't offer one. Harvard doesn't offer one. Stanford doesn't offer one. Not uncommon that you can go to all these major universities and never take one retirement planning class. It's just
but what I was hoping is that people could hear the message from such a young youth, right? How powerful that was about your physical healthness, your physical fitness, how important that is, and it's also important to keep your financial fitness.
Right.
This was what she wrote in her essay: physical as well as your wealth, right? So you need to manage both, physical and financial. Yeah. And so her message was, but did you hear her talk about, I really didn't understand what stocks were, but she got into it. She learned what stocks were. Why do you invest? I mean, so,
stocks,
I mean,
bonds, mutual funds, investing. I mean,
this is a kid talking like this.
We underestimate the kids. When I was playing chess,
exactly, they'll learn anything.
They will learn
anything. You just got to feed it. You got to feed it.
We were told that you couldn't learn chess until your high school. Today, where they teach chess players, the best ones, elementary school. because the elementary school kids will pick it up like that.
Unless you're Elliot, you teach them when they crawl.
For years, there were myths that we couldn't teach them this stuff. You can. We just have to design our education system to teach financial fitness. We call it financial fitness rather than literacy to people in elementary school. That's it. But
but you need to be physically fit and you need to be financially fit. And when you have the two combined, then you got health and wealth, right? Wealth and health. You got a wealth of health and a health of wealth. And people just don't get it. But one of the talks we had with Edward and Vicki, God love her, she believes in the human spirit and resilience. But something I learned this past year in a conversation I had with one of my doctors, and I overheard him in the other room talking about